Hello, I'm Dr. Andy Letcher. I'm an oral maxillofacial surgeon practicing in Atlanta, Georgia. And I want to talk to you about the surgical treatment options for correction of sleep apnea. And it's a big part of my practice. And as an oral maxillofacial surgeon, we actually have a procedure where we bring the upper and lower jaws forward to advance it. And it literally skeletally opens the airway up from abnormal to normal. And it does amazing things for people's health. And one of the reasons I want to talk to you about this is there's a lot of misconceptions about this procedure. Like, for example, we don't break the jaws, we cut them. You're not wired together for 6 or 8 weeks. You literally wake up and you can open and close your mouth. And so these procedures have become very proficient, and it's the ultimate treatment for breathing disorders. We do a lot of these procedures. In the last 8 or 10 years, our understanding of it has really blossomed. And so it's a great thing for you to know if you suffer from this, to understand the options. You may think of sleep apnea as just the person that goes to sleep and he quits breathing at night and suffers, an older, unhealthy person, but sleep apnea is a spectrum from snoring, especially in young kids, to young 20, 30, 40-year-old people that are not overweight, that are skinny, fit people, but they just don't sleep well, and actually that's a form of sleep apnea. And what sleep apnea really is, if you skeletally have too narrow of an airway, you cannot breathe well, and it throws your sleep off. And there's different forms of it, and it prevents you from getting a good night's sleep. And what's really unknown is how many people suffer from it. And we've discovered last decade or so that a large proportion of the population has issues with that. Basically, their airway is too narrow, they don't sleep well, and it causes a myriad of symptoms, medical and dental. They get TMJ, but from a medical standpoint, they get high blood pressure, they fight their weight, they get food cravings, they develop insulin resistance at young ages. And for many of these patients, they're in their 20s and 30s, and they haven't had all the destructive effects yet. And so we're intercepting many people in their 20s and 30s because we in dentistry and medicine can diagnose them quicker than a lot of the medical people that don't know sleep apnea. And so if you wait till you're 60 years old and you've got this terrible disease, you've already had permanent injury to your, believe it or not, your brain, your heart, and so forth. And so we correct a lot of these people when they're still 30 years old. They're not overweight, but they grind their teeth. And so the patients we see, they come in, and you may be one of these people, 30, 40, 50 years old. You come in, you just feel like you don't sleep. You talk to your doctor, maybe you should get a sleep study. You can have borderline high blood pressure. You maybe have high blood pressure, maybe suffering from gaining weight and becoming overweight. A lot of patients are on Synthroid because their hormones are messed up. And a lot of this is due to airway. Not everything, but a lot of it is. And so patients sit down, I look at them, and I can look at a lot of patients, tell them just if their face didn't develop, their jaws didn't come far enough forward. But what's really nice in oral surgery, we literally can take an x-ray from the side of your head called a lateral cephalometric radiograph, and it shows us the width of your lateral pharyngeal airway. And some people come in and they give me these symptoms, and it's 3 or 4 millimeters when it should be 11 or more. But sometimes they'll come in and they have a great big airway, 12 or 13. I go, okay, we need to look elsewhere for your symptoms. But it's relatively easy to diagnose this. When I look at that x-ray, we can also take a CT scan to see it. And so it's not a difficult diagnosis to make, especially because of all the signs and symptoms of a poor airway, how it throws your sleep off, and the lack of the sleep, the deep sleep, causes so many symptoms of sleep apnea. And this is something I want to explain. It's called upper airway resistance syndrome. So as I said, the spectrum, snoring to the apnea in the middle, is the person we refer to as a middle-aged female, 40 years old, that comes in with TMJ issues, but it can be men and as well. But they have all these complaints that are mild, aches and pains, and their airway on the x-ray is narrow. So why does that narrow airway cause all these medical and dental issues? Mostly medical. So if you go to bed and your airway, instead of being 11 millimeters, is 4 or 5, so you're 50% constricted. When you breathe, it takes a lot more work for your diaphragm to move a breath in and out. And so as you fall asleep and your muscles relax, you move less air. And so say you're going to get 8 hours of sleep. Your goal is to get 8 hours sleep. You go to sleep at 10. You're going to get up at 6. So if you go to bed and you fall asleep at 10, and in that first 30, 40 minutes you're breathing, and since you've got a narrow airway, you're going to breathe less efficiently. So what's going to happen is you're going to bring in less oxygen in that 45-minute period, so your blood oxygen levels are going to drop. Your carbon dioxide levels, which are exhaling, go up, so it makes your blood more acidotic, which your brain picks up and says, hey, we've got a problem here. This is not healthy, the blood's off. Let's fix it, and your brain can fix it. It does a couple of things, does several things, but one thing, it sends out cortisol because your body's under a stressful situation, and it releases cortisol, which is a stress hormone, and it also releases adrenaline in the form of noradrenaline, and that turns on your sympathetic nervous system, the fight or flight. And so that is your body's attempt to correct this. And so what the adrenaline does, it'll go to your pharyngeal muscles, tense them up so it opens your airway up. It'll clench your jaw, slide your jaw forward. That's why a lot of people grind their teeth. It also causes restless leg syndrome, things like that, because it stimulates a lot of limb movement, because basically it's your fight or flight system. It's going to make your diaphragm take deeper breaths. It's going to speed up your heart rate to pump more blood through your body, to bring more oxygen in your brain. So that's your body's and brain's adaptation to fix this. And so you say, oh, great, I fixed it. But the problem with that is you don't wake up, you don't know this is going on, but your brain undergoes what's called a micro-arousal. So your brain has to wake up enough to send these signals out. And that's going on simultaneously while your body is trying to get into deep sleep. And the deep sleep is so critical for health in many ways. Deep sleep is what's critical, and your brain is trying to stay in a deep sleep during most of your sleeping period. And there's two types of deep sleep. There's the rapid eye movement sleep, REM we call it, which you get more of that in the second half of the night. And then the non-REM sleep, like non-REM. The non-REM deep sleep is, there's basically 3 stages, N1, N2, and N3. N1 and N2 are just shorter stages as you're falling asleep, but the N3 is the deep stage of the non-REM sleep that you want to be in for a long period of night. And so during that stage, a lot of great things happen for your body health, and it's really critical to stay healthy. Number one, it activates the parasympathetic nervous system, which relaxes your body, maintains low blood pressure, and helps your blood vessels relax. Number two, there's hormones that are sent out, such as growth hormone and other wound repair hormones to heal your injuries and strains you've had during the day. Number three, which is really important, your immune system gets strengthened. So when you get into this deep sleep, this slow cycle sleep waves, they activate and re-energize your immune system, basically reloads your immune system's weaponry arsenal. And that helps you prevent colds and flus and things like that. That's why people that don't get deep sleep have dark shadows under their eyes, because their immune system's weakened. Blood sugar controlled when you get deep sleep, your insulin secretion, your cells become insensitive. All that goes on in deep sleep. What's really important, they just discovered this in 2011. In this deep sleep, your brain cells shrink, but your glial sites in your brain shrink by about 40%. It's like, why would they do that? Well, they do that because they discovered there's a system in your brain that flushes out metabolites. It's called the glial lymphatic system. And as we are awake in the day, the metabolic proteins that accumulate, such as amyloid beta proteins, tau proteins, they accumulate, they need to be flushed out. And the glial lymphatic system does this in deep sleep. If you do not flush them out and they accumulate, they cause neurofibrillary tangles, which leads to early onset dementia and Alzheimer's. And so this is really critical, and it's proven that people that don't sleep enough have early onset Alzheimer's and dementia. It's a big area of research nowadays. During your REM sleep, your body basically provides its emotional stability. Like if you have a stressful day, you have things you go to sleep at night, your brain sorts that out when you dream and you wake up and you're not so stressed. It kind of sorts it out so you can deal with it and it's not tearing your life up the next day. It actually makes you feel good, makes you happier, so people are less depressed after a good night's sleep. Another big deal is your cognitive learning when you're kids. Up to in the early 20s, children need their deep REM sleep to provide proper cognitive development. If they don't get their deep sleep, the cognitive development doesn't occur, and that is not reversible. It's irreversible. So children that don't get deep sleep, they're the ones that are more prone to ADD, other types of things. So that is really critical. Also, your deep sleep, you get your short-term memory and the long-term memory in both the non-REM and the REM sleep. So that's important for learning. If you go to a meeting today and you learn things, if you don't get deep sleep, you're not going to retain as well from both the non-REM and the REM sleep. One thing that happens if you get a poor night's sleep, you're going to wake up with such poor sugar control. If you get poor deep sleep, your pancreas can't secrete insulin and your cells become less receptive to it, and you literally wake up somewhat of a insulin-resistant type 2 diabetic. Many patients after the surgery, they get off their metformin. It's so patients that have insulin resistance, a lot of times are on metformin because their blood sugar is under control. I described to you the importance of deep sleep. So patients that have a narrow airway, one form or the other, that gets fragmented from the adrenaline release and the cortisol release. So those patients have high epinephrine in their system, cortisol in the system, and they basically get wired at nighttime and the daytime. So just that narrow airway throws your sleep off. And that's why sometimes patients wake up at 3 in the morning and they can't get back to sleep because their body's loaded up with adrenaline. And the tough part about this is this doesn't just go away in the morning. You wake up and this sympathetic nervous system, which is your fight or flight, stays on day or night. And so it pretty much wreaks havoc with your body all day long. So the great thing is these procedures to correct this, I've been doing them for over 30 years and become proficient at it, but what we really learned in the last 8 or 10 years is the benefit of sleep. And so we've modified them slightly. We're bringing the jaws forward instead of 7 or 8 millimeters, we'll bring them forward 10 or 11 millimeters, open the airway up, and it's such a dramatic improvement. It's about a week or so of recovery that you have to deal with, but it's not a terrible recovery, it's not a painful recovery, and it's a safe procedure. Put all this together, and you're gonna lose weight and feel better. It's like, it's so worth it. And also, if people have CPAP every night, they get a poor night's sleep, it's when you weigh the pros and cons of a lifelong of health, people get better relationships with their friends because they're just in a better mood, plus their spouses don't get woken up by their snoring. Most of the snoring gets eliminated by it. So this is what this procedure is all about. Advancing the upper and lower jaws is truly the definitive treatment for sleep apnea. There's other procedures the ENT do, especially in kids, remove tonsils and adenoids. That treats it in children. There's also the septum can be deviated, the turbinates can be enlarged, and a lot of ENTs do those as well, but that treatment probably only provides 10% at the most benefit that bringing the jaws come forward. And actually, when we bring the jaws forward with this maxillofacial advancement, the turbinates and septum are right in front of us, so we actually reduce the turbinates and straighten the septum out as part of this procedure. And so there's really nothing in healthcare that can treat sleep apnea as well as a maxillofacial advancement. The patients I'm doing this week, there's 4 things I go through with that are a big deal about this procedure. Number 1, you're on soft foods for 6 weeks, and by that we mean you can have mac and cheese, pasta, soft foods. You cook seafoods like tilapia and salmon, but you cannot have pizza, you can't have tacos. They crave tacos and pizza in about 4 weeks, but they have to wait 6 weeks. So that's number 1, because you have to let the bones heal together. We cut the bones precisely, fit them together. Number 2 is you get a lot of swelling. Your face gets mega swollen for a couple weeks, and sometimes more than you think it would be. Some people don't swell a lot, but most do. So everybody that sees you in a couple of weeks will know you've had surgery in your face. It's quite a bit the first week. By 2 weeks, It goes down to the point that if you go out, people that don't know you, you might look like a person with puffy cheeks. It all completely goes away. Most times it's gone in 6 or 8 weeks. There's a few patients, like people at a more advanced age, we do this on, it takes maybe several months for their face to soften up and look normal. The third thing is you get some numbness in your face, which is due to the swelling that I just described. When we reset the jawbones and move your face around, there's some nerves that provide fuel to your jawbones and to your lips. They don't get cut or anything, but they get swollen. And so you get some temporary numbness to your lips in this area and the bones, which is a beautiful thing because usually by 2 to 3 days later, patients have very little pain. They don't need narcotics. Most people use some ibuprofen for the first week or so, but narcotics, usually cut out sometime in a few days, maybe longer. So you don't recall this as a painful surgery. The fourth thing about this procedure, there's about a 2-week recovery from it. Not really 2 weeks. I tell you to pick a time in your life that 2 weeks you don't have any major obligations. The first week you have a lot of swelling, you're dealing with a stiff jaw, and day 7 and 8 you start getting your energy back and you're out and about driving a car, doing things, but you don't really have all your mojo for a couple of weeks. The thing is, like, everything from here down works great. It's just to have this stiff swollen jaw for that first 7 or 8 days, and it takes a little while to get used to eating the softer foods and so forth. But that's it with the surgery. I mean, they're safe. I've done several thousand. We don't have an issue with infections. We don't have big bleeds with it, nothing like that. It's a really well-refined procedure to the point that we can do them safely in our outpatient facilities. There's some people that do these in hospital centers, but most people that do these on a fairly common basis have moved into their surgery centers because you can control more factors, you're more proficient, and it seems like it'd be a cleaner and better environment. The benefit patients receive is pretty incredible. They come in afterwards. We see them in a week later, sometimes 3 weeks and 6 weeks, and there's such an improvement across the board. They sleep better. People that have been on CPAP, they get off their CPAP. They just have more energy in their face and their eyes. They go to work, they get promotions, improvements in job performance. It's just, your energy is so high that everything in your life gets better. People across the board lose weight. I'd say it's one of the more common things. They come in, their face is leaned out, they look sharper, they feel better, and they basically get off their Synthroid if they've been on it. Their libido jumps up, their sex hormones get back to normal. Patients that have had a high blood pressure, I mean, most of them get off their blood pressure medications unless they have kidney issues, but it's common for patients to have 2 or 3 blood pressure medications, and after the surgery, they're on none. Patients feel so much better if they've been on antidepressants. Most of them get off their antidepressants. But what's really great about this too, I mean, I truly in my heart feel we do these on patients, they're gonna live 10, 15 years longer because many factors. Number one, we've made their cardiovascular system healthier. Blood pressure gets lowered. Their blood vessels are gonna have less inflammation. They're eating better. They've lost weight. All these longevity issues, it just comes because now you can breathe and get deep sleep. The glial lymphatic system flushes out your metabolism, so if people don't correct this, they're going to be prone to Alzheimer's and dementia. So we improve that situation in their lives, and it's pretty amazing. And there's studies done that the amount of deep sleep you get, and basically the amount of sleep you get, is correlated in a linear relationship to how long you live. And so people that get more sleep basically live longer, and the deep sleep helps you live much healthier too. So that's what we do for people. Someone came along and you said, hey, we've got a new revolutionary new drug for you that makes you more creative, makes you happier, less anxious, gets rid of your food cravings, and it's going to lower your risk of heart disease. It's going to make you healthier. You say, hey, I want that drug. Oh, it's free. It's called a good night's sleep. Well, this procedure helps give you that good night's sleep. There's a cost involved as far as missing time off work, like 8 or 10, 2 weeks of time. There is a financial cost with it. Your medical insurance covers some of it, but there is out-of-pocket expense, but we work with people on that. So in this video, I didn't want to make it too long, but on our website, joyimplant.com, we've got some testimonials from patients, and you can go to our website, explains this procedure a little bit more in detail to learn more about it.